Welcome back. This is Gateway 101. In Gateway 101, for those of you who have been following us, you know that we have made a lot of improvement and a lot of sacrifices in helping people go for their doctor appointment. We have created a lot of healthcare awareness. That's why our email is stuck. There are a lot of email coming in, and we do appreciate you. Okay, it means a lot to us. It means that what we are doing in the community is great. So we really appreciate your comment and your support. you know so what you need to do is subscribe to this channel so that you can get more updates. Subscribe for more updates. Subscribe for more updates. That's all we do in Gato 101. Like we said, whatever we do here does not constitute diagnosis, but we are only creating a healthcare awareness so that you can be better informed, and also give you some preventive tips, because prevention is better than cure, and we'll also give you some simple home remedy to help alleviate illnesses. Okay, so in today's live broadcast, we're going to be talking about thyroid. We'll look at what is thyroid. We're also going to look at what is thyroid, the difference between hyperthyroidism and hypothyroidism. We'll compare and contrast these two things. We're also going to look at the causes and some simple home remedy to help alleviate thyroid. So we're going to be looking into all this. So at the end of the day, like as I already said, prevention is better than cure. So let's dive into it. So we're talking about hyperterrorism. Okay, what is hyperterrorism? Terrorism. Hyperthyroidism is a condition where your thyroid gland become overactive and produce too much thyroid hormone. Okay, when we say hyper, is high. In a layman language, it is high. Okay, when we say hypo, in a layman language, it is low. When we say hyper, in a layman language, it means overactive. Okay, so what we are saying here is that in hyperthyroidism, it's a condition where your thyroid gland become overactive and produce too much thyroid hormone. Please kindly subscribe for more videos. Okay, subscribe for more videos. So the thyroid is a small butterfly shaped gland located in the front of your neck. It controls how fast your body works, your metabolism. So what happened in hyperthyroidism? In hyperthyroidism, when the thyroid releases too much hormone, your body speed up. This affects your heart, your digestion, your mood, and your energy level. Do not forget, in a layman language, we're saying that hyper, high, overactive, hypo, low, not active. Okay, so we're talking about hyperthyroidism. Okay, I would say that the common causes of hyperthyroidism would be Graves' disease. That's the most common cause of hyperthyroidism. Okay, grave disease. Grave disease is an autoimmune condition where the immune system attacks the thyroid and make it overactive. Please kindly subscribe for more videos. Okay, the thyroid in grave disease is the most common cause of hyperthyroidism. I was saying that a grave disease is an autoimmune condition where the immune system attacks the thyroid and make it overactive. So the thyroid node the loops that produce excess hormone. Thyroiditis, it is the inflammation of the thyroid. So too much thyroid medication can also cause hypothyroidism. Or if the thyroid is inflamed, inflammation of the thyroid can also lead to hyperactive. Okay, the thyroid node, which is the loop that produces excess hormone, can also cause hyperthyroidism. So, but the most common symptoms of hyperthyroidism will be unexplained weight loss. That is one of the most common symptoms of people with hyperthyroidism. Rapid or irregular heartbeat. If you are having rapid or irregular heartbeat, it might be your thyroid is hyperactive. So rapid irregular heartbeat, yeah, it's an emergency situation. So if you're having a rapid irregular heartbeat, make sure you check with your care provider. It might be your thyroid is hyperactive. You feeling nervous, anxieties, or irritable, or you irritated. You're feeling nervous. You have anxiety. You get irritated. These are some of the common symptoms of hyperthyroidism. Your hands are shaking, tremors. Your hands are shaking. It's another common symptom of your thyroid is hyperactive. Excessive sweating is another common symptom that your thyroid is hyperactive. Okay, please kindly subscribe. Thank you so much. And Hardy those are short. I love you too. Okay, thank you so much. I say hi to you already. Okay, thank you so much. Thank you so much for watching this live broadcast. Okay, thank you so much. But don't forget to subscribe for more. Okay, subscribe. Okay, so if you excessive sweating, if you are sweating excessively, we say that your thyroid might be hyperactive. Or heat intolerance. So another common symptom of hyperthyroidism. Frequent bowel movement, not diarrhea now. Diarrhea is different from frequent bowel movement. Might also be a common symptom of hyperthyroidism. You find it difficult to sleep. Your thyroid may be hyperactive. You're finding it difficult to sleep. A large thyroid gland. Yeah, because the thyroid is situated in your neck, right there in front of your neck. That's where the thyroid is situated. So if your thyroid become a large gluter, if your thyroid is a large become gluter, that means you are having hyperthyroidism. Your thyroid is super overactive. In women, irregular period. Okay, if you're a woman and you're having irregular periods, it might be it's a common symptom of hyperthyroidism. So you need to check with the medical provider. When it becomes serious, okay, if hyperthyroidism is not treated, okay, it can lead to irregular heartbeat, heart rhythm problems. Okay, it can lead to weak bone, osteoporosis if your hyperthyroidism is not treated. And it also can lead to a life-threatening condition, which we're going to be talking about shortly. A life-threatening condition called thyroid stone is a medical emergency. Okay, so how is it diagnosed? How do we diagnose hyperthyroidism? Doctors check for your blood tests. They will do what we call a TSH, T3, T4 level. So they draw blood to check for your TSH, your T3, and your T4 level. So based on your blood work, the doctor should be able to tell whether you're having a hyperthyroidism or hypothyroidism or your thyroid level is normal. Okay, sometimes thyroid scan or ultrasound can also be done. Okay, so what are the treatment options? medication to reduce hormone production. Sometimes give them how they call it now, thyroid. This thyroid medication, Thyroid. Yeah, Thyroid. So sometimes they give them Thyroid. Don't forget now, this is not a prescription. We're just telling you what doctors might order. So sometimes they put them on Thyroid. Okay. So sometimes, if in the severe case, they put them in radioactive iodine therapy. Okay, in the severe case, they put them radioactive iodine therapy. Then, in a very serious case, a very severe case, surgery may be recommended. Okay, so let's look at the difference between the hypo and the hyperthyroid. We will say thyroid is hyper. That is, in the layman language, it is high. We will say it is hypo. In the layman language, it is low. So let's look at the difference between hyperthyroid and hypothyroid. Okay, so in hyperthyroid, thyroid activity is overactive. That's why it is called hyper. It's high, overactive. So why thyroid activity in hypothyroid is underactive? You see the difference? One is high, overactive, the other one is underactive. So the hormone level in hyperthyroid is too high, hyper high, while the hormone level in hypo is too low. Okay. Body speed. Body speed in hyper is high. The speed is high, while in hypothyroid is slow down. Weight changes in hyper, you lose weight, while in hypo you gain weight. Because don't forget that thyroid control your metabolism. Okay, so when it is hyper, it speed up everything. Okay, so in weight changes, you lose weight if you're hyper, but if you're hypo, you will gain weight. Okay, heart rate in hyper, you people end up, if not treated, they have it fast, heartbeat is fast, and it is irregular, which is dangerous. While in hypo, it is slow heart rate. So the temperature tolerance for hyper, people who are hyper, they feel hot. While for people who are hypo, they feel cold. See the difference between the hyper and the hypothyroidism? So the MOOD, the mood level for hyper will be anxiety, okay, and irritability. While in hypo, they become depression and fatigue. So while bowel movement in those with hyperthyroid will be very frequent, those with hypo is constipation. So the hyper and the hypothyroid comparison is like opposite of each other. One hyper is high, hypo is low. Okay, so the common causes of hyperthyroidism, like I was said, will be the grave disease, thyroid node, thyroid inflammation. These are the most common causes for hyperthyroid. While hypothyroid will be Hashimoto inflammation, okay, or thyroid surgery. They probably remove the thyroid gland. Then iodine deficiency or certain medication can also cause the hypothyroid. So the simple way to remember will be this: will hyper, high and fast; hypo, low and slow. Okay, so that is simple way to remember whether you're having a hyperthyroid or hypothyroid. So hyper will be high and fast. Hypo will be low and slow. So natural way to support thyroid head. This tip helps support thyroid function, but they do not replace medical treatment if needed. Okay? One, get enough iodine, but not too much. So you if you're having a thyroid problem, all you need will be your thyroid, your iodine salt, but not too much salt. Too much salt will result to different thing entirely. So you should have enough iodine salt to your meal. Seaweed in moderation. Seaweed in moderation. Eggs. Daily dairy. Dairy will also be another good source of iodine. So too much iodine can actually worsen thyroid problem. Okay, so it should be moderate. Then eat salmon-rich food. Salmon-rich food. Salmon help thyroid hormone conversion, such as Brasinalot. 1 to 2 per day is enough. Tuna. Your tuna is also a good source of salmon-rich food. Sunflower seed and eggs. These are good source. Okay. Also, try to manage your stress. Stress management is a chronic stress affect your thyroid balance. So try to manage stress. One way you can manage stress is what? A deep breathing. You breathe, take a deep breath. Hard. In, hard. So you do that continuously. So that help reduce stress. Or you walk around, you stretch yourself. That help release stress. So stress management is key because chronic stress can affect your thyroid balance. Okay, regular sleep. We will always emphasize on sleep. Get enough sleep. Get enough sleep, because irregular sleep, or if you don't sleep well, this will do what? Will cause you stress, and chronic stress affect your thyroid. Okay, so gentle exercise. We recommend that you do at least 30 minutes of exercise a day, 3 times a week, will be a great help. Or 150 minutes of exercise in a week will be also be of great benefit. You do a lot of meditation. This helps reduce stress. Gentle exercise, not acrobatic or vigorous exercise, will help manage stress also. Improve your gut, GUT, improve your gut health. Autoimmune thyroid problem are linked to gut health. So eat a lot of fibers. Include fermented food like yogurt. Reduce processed food. Okay? Reduce processed food and avoid excess soya and ultra processed food. Too much soya beans or soya food may interfere with thyroid function, especially if iodine is low. Symptoms that mean that you should see a medical doctor immediately. So if you're having these symptoms, we strongly recommend that you seek urgent care immediately. For hyperthyroidism, very fast or irregular heartbeat, you need to see a medical doctor immediately. If you are having hyperthyroid and you are experiencing a very fast or irregular heartbeat, this is a medical emergency. So you need to seek urgent care help immediately. Or you're having a chest pain, it's a medical emergency. You need to seek help immediately. If you are confusion, you also need to seek medical help immediately. You're having a high fever, you need to seek medical help immediately. Then, if you are having a severe restlessness, you need to seek medical help immediately. These signs signal thyroid storm. And do not forget that thyroid storm is a medical emergency. Okay, so if you're experiencing any of these symptoms, please seek medical help immediately, because these signs signal thyroid storm, and thyroid storm is a medical emergency. Okay, so for hypothyroid, remember hypo is low and slow. Okay, if you're experiencing extreme fatigue, you're experiencing severe swelling, you're experiencing slow heart rate, you are confused, very low body temperature, this sign may signal mazedama coma. Mazedama coma. Rare but is life threatening. It is rare but very life threatening. Okay, so for the sake for sake of you who are just joining us, we go to recap. Okay, we'll recap so that you can better understand what we are talking about. Okay, it's very important. So for the sake of you who are just joining us, let us let's recap. Okay, so we're going to recap so that you can at least get a good grip of what we are talking about here. So we are talking about thyroid problems. Okay, so we're talking about thyroid problem, and we are saying that hyperthyroidism is a condition where the thyroid gland become overactive and produce too much thyroid hormone. We also said that the thyroid is a small butterfly-shaped gland located in the front of your neck. It controls how fast your body works and your metabolism. We also said that when the thyroid releases what happens in hyperthyroid is that when the thyroid releases too much hormone, your body speeds it up. Then this affects your heart, your digestion, your mood, and your energy level. We also look at the common causes. I would say that grave disease is the most common cause of hyperthyroid. I would say that grave disease is an autoimmune condition where the immune system attacks the thyroid and make it overactive. Okay, thyroid node, that the loop that produces excess hormone. We also talk about inflammation of the thyroid. And these are some of the most causes of hyperthyroid. I would say that too much thyroid medication can also lead to hyperthyroidism. I will look at the common symptoms of hyperthyroid. I would say that unexplained weight loss is a common symptom of hyperthyroidism. Rapid or irregular heartbeat is a common symptom of hyperthyroidism. I would say that feeling nervous, anxiety, irritated is also a common symptom of hyperthyroidism. I also said that shaking hand and tremors is another common symptom of hyperthyroidism. Excessive sweating, heat intolerance, frequent bowel movement, difficulty sleeping, and you also have a large thyroid, the glotter becomes swelling. Okay, those are some of the symptoms of hyperthyroid. And I would say that in women it will be irregular period. If you're experiencing irregular period as a female, you might be having a hyperthyroidism. I would say that when it becomes serious, if untreated, hyperthyroidism can lead to heart rhythm problems like fast irregular heartbeat, weak bone, osteoporosis, and a life-threatening condition called the thyroid stone. Thyroid stone is a life-threatening condition. And how is this diagnosed? You go to your medical doctor, you draw a blood work, and the doctor will look at your TSH level, your T3, your T4 level. So they look at this, they look at your lab to see whether it is high, normal, or low. If it is high, it is hyper. If it is low, it is hypo. Sometimes thyroid scan or ultrasound can also be done. To treatment option, medication to reduce hormone production might be a choice prescribed by your medical provider. Radioactive iodine therapy can also be done. In a severe case, surgery may be done to remove the thyroid. So, okay, we also look at the difference between hyper and hypothyroid, and we say that in thyroid activity, hyper will be overactive, hypo will be underactive. I would say that hormone level in hyper will be too high, while the hormones level in hypo will be too low. We also said that the body speed in hyper will be high speed, speed up, while in hypo, slow down. Body speed level in hypo, slow down, hyper, speed up. And we will also look at the weight changes. I will say that weight loss in hyper and weight gain in hypo. Then we also look at heart rate. And we said that in hyper, it will be fast and irregular, while in hypo is slow heart rate. Then the temperature tolerance for hyper will be they feel hot, in hypo they feel cold. Then their mood level, MOOD, will be anxiety, irritability, while in hypo will be depression, fatigue. Then the bowel movement in hyper is very frequent, while in hypo there will be constipation. So the common causes of hyper, like as we said before, is grave disease, the thyroid node, which is, and also thyroid inflammation. Thyroid node is the hormone that produces the thyroid. Okay, overproduction will cause hyper, and the thyroid inflammation can also cause hyperthyroidism. Why hypo will be Hashimoto inflammation or thyroiditis, thyroid surgery, or iodine deficiency can also lead to hypothyroid, or certain medication can also lead to hypothyroidism. We also talk about this simple way to remember these things will be hyper, high and fast, hypo, low and slow. And we'll also look at some natural way to support the thyroid health. I will say that this tip helps support thyroid function, but do not replace medical treatment if needed. So we say you should get enough iodine, but not too much. We also say that iodine salt will also help, but don't get too much iodine salt. Seaweed in moderation is also ideal. Eggs and dairy product is also recommended, but too much iodine can actually worsen thyroid problem. Okay, so know that. I will also say that eat selenium-rich food. Selenium-rich food. Selenium help thyroid hormone conversion, such as Brazilian nut, your tuna, your sunflower seed, and eggs. Okay, we also emphasize that you should manage your stress because chronic stress affects the thyroid balance. So deep breathing, try to relieve stress, walk around, stretch, regular exercise, but gentle exercise, regular sleep, prayer, and meditation, help manage stress. We also said that improve your gut health, gut health. Autoimmune thyroid problems are linked to gut problems. So eat fiber food, include fermented food like yogurt, but reduce processed food. We also said that you should avoid excess soya, SOI, and ultra-processed food. Too much soya may interfere with your thyroid function, especially if iodine is low. So, one will also strongly recommend that you should seek a medical help immediately if you have hyperthyroidism and you're experiencing a very fast or irregular heartbeat. Seek medical help immediately. You have a chest pain, seek medical help immediately. You are confused, seek medical help immediately. You have a high fever, seek medical help immediately. And you have a severe restlessness, seek medical help immediately. Okay, if you are having a hyperthyroid or you are having these symptoms, you need to seek a medical help because this symptom signal thyroid storm. Thyroid storm is a medical emergency. So pay attention to these symptoms and measuring. For hypo, you feeling extreme fatigue, severe swelling, your gut becomes swollen, or your body becomes swollen, you have slow heart rate, you are confused, your body temperature is very low, this signal eczemal coma. Rare, but it is life threatening. Okay, so we talks about these symptoms, and we always places emphasis on prevention because prevention is better than cure. Do not forget that while this symptom does not constitute medical diagnosis or treatment, we strongly encourage you to go and see your medical doctor immediately. Okay? All we are doing here in Gateway 101 is to create healthcare awareness. Okay, we'll test you if you're experiencing these symptoms, go and seek medical help. Because if you are having a thyroid storm, like I said, it is a medical emergency. You need to act fast. Okay, if you're having a thyroid storm, you need to act fast. You need to seek a medical help immediately because it's a medical emergency. Okay, so stay. Thank you all for staying to the end of this broadcast. To come your way again. This is Gateway 101. Do not forget to subscribe for more videos. Do not forget to subscribe for more videos. Okay, to come your way again. This is Gateway 101. Thank you all for watching and bye for now. Thank you.